Hi everyone. So we thought we've got 10 minutes to try and tell you as much as we can about the ecosystems in Ireland. And perhaps the easiest way to do that was to bring both of us along. Because I'm the Chief Information Officer in Ireland, and Maria, my colleague here, looks after all of our engagement with clinicians, with patients, with the public, and with politicians as well across Ireland. And I think one of the things from an ecosystem point of view, how we've done that has been very much around that open, transparent engagement. So we'll dive into where we're going to go. I mentioned this morning, and I just thought it was worth, particularly with what Brian was just talking about, is the starting points, because of the financial situation in Ireland and in Greece being so similar. It's clear that we can learn an awful lot from each other. And for me, that's why the ecosystems exist, to allow us to learn, to allow us to not make mistakes that other people have made, to try and build on positivity that's there. eHealth is not an easy business for any of us to be in, let's face it. And the more support, the more access to other people and other people's information we can get, the stronger we can be at delivering and bringing the two countries and the many countries and the different cliffs together. eHealth is about changing this. Our ecosystem that we have in Ireland is a year old. And in a year, it's moved from talking about and defining what our e-pharmacy program is, to beginning to put the wheels on our EHR program, to giving patients a voice in front of clinicians and people doing technology. One of the most powerful things I've seen is a patient stood on the stage at the ecosystem meeting saying, why can't you just get on with this? Do this and make it happen. Move my paper away and give me access to my records. I think a patient saying, it's always been done this way, is a way more powerful way in the ecosystem of actually changing culture and changing what we deliver. eHealth Ireland as an organisation is and was set up politically. But what we've done over the last year using ECHA Alliance, using the ecosystems, is try to make that open and transparent and bring that in a different way. Changing cultures is very difficult. This is my first visit to Athens, so hopefully I can get away with saying this. These are my two favourite cities in the world, Barcelona and Dublin. Very, very, very different cities, very different cultures. An English person in Dublin would probably describe most roads leading to a pub. An English person in Barcelona would describe most roads as being very much blocks and leading to something quite historical and quite amazing to look at. How do you use an ecosystem to change those cultures? How do you use an ecosystem to map those very different cities? I think that's been a big part for Ireland in particular over recent times, is using that ecosystem to change perceptions and build bridges that span the whole different way of delivering.
Oops. So the world has never been changing so fast, and we're really aware of this. So there's going to be 80% of the world are going to have smartphones by 2020. And with engaging with different groups that we work with, we're seeing that they really, really want to use digital technologies for everything they do, not just booking flights or buying their insurance. They want to have digital technologies in their health as well. There'll be over 500 million healthcare apps will actually be used this year. So we know it's something we need to really address for consumers because they actually expect it now as well. So Richard spoke about this slide this morning, and it's something that we really try and keep close to our hearts when we're actually working and collaborating with different organisations, is that you actually have to have a vision and a plan, and you need to work together and listen to what people want and find out what their views are and what their perceptions are. And this is what happened in Singapore. This is Singapore in 1969, and this is our central business district. And what they did is they worked really well together. Lots of different groups had a plan, had a vision, decided what they wanted, and put a plan in place to actually get there. And regardless of politics or regardless of finance, they achieved what they wanted to achieve. And it's something we're really trying hard to do in eHealth Ireland as well, is listen to other people, collaborate together, using things like the ecosystem, and finding out if there's different ways we can actually move things forward, regardless of what's actually happened politically or financially. So the world has never been changing so fast. When will it come to health? And this is something that we are really strongly trying to change in Ireland with our eHealth.
What's interesting there is very much how we now move towards our minister in the Republic creating what's called the Future of Health Committee, a cross-party committee to deliver a 10-year plan for health. But Brian was telling us literally over lunch today, the north of Ireland has announced a 10-year plan for health. Countries are beginning to realise that investment in health can't be done on a 12-month basis. Currently, the Republic of Ireland finds out what its budget is around now for next year, and next year only. That means that investing in this, an electronic health record for Ireland, is very, very difficult. What we've been able to do, though, using the ecosystem, building on our relationships, is create a different way of describing what an EHR for Ireland looks like. We're not going to produce 600 pages output-based specification. We're going to create 20 fictitious people of Ireland, give them names, give them characters, give them illnesses, give them clinical specialties. And we're going to ask EHR vendors to tell us how that changes those 20 people's lives. We're trying really hard to make sure that that becomes a public website, a public document, so the public can understand why investing over 10 years in Ireland is a different way of delivering. We spoke this morning around the Knowledge and Information Plan in Ireland. This document was created by the team, for the team, but then was taken to the ecosystem to validate what was in there. Our first ecosystem meeting was 71 people. The last ecosystem meeting we had was 190 people. Something of a birthday celebration with Brian cutting cake and all sorts of fun things as well. But that's a big move forward, and this is based on and being able to build from that plan. One of the areas we didn't mention this morning was the lighthouse at the bottom. The ecosystem helped us define 3 projects across Ireland that we call lighthouse projects. In epilepsy, seek into the genome of children under the age of 5 so we can target the right drug immediately. In haemophilia, providing effectively a supply chain management solution, dropping treatment into the fridge of the patient and being able to manage that treatment just in time. And the last one around bipolar disorder, helping us to create a hackathon for patients that have bipolar. Currently, a solution isn't available in Ireland for any digital sort of connections for a patient with bipolar, which means their once-a-month visit to their psychiatrist normally starts with "How have you been this month?" and normally finishes with "grand thanks." Not the greatest way to deliver care and move forward.
So one of the things we're trying to do is raise more public awareness around what's happening in eHealth in Ireland. We've been quite lucky to engage really strongly with healthcare professionals in Ireland, but we're trying to push that even further now and try and get the public to be aware of the different things that's happening, that the clinicians are doing, that we're involved in, to try and put it, like digital health at the heart of our national agenda. And what we're doing is we're having a thing called a Health Innovation Week. Now, I would like to point out that this Health Innovation Week started as 2 days, but we can't say no to anything, so it's now grew to 6 days. And it starts with the Bipolar Innovate that Richard was speaking about there. It's a hackathon that we're working with Trinity University with. It's going to be all based around creating different technologies for bipolar. And the next day then, on the Monday, we're going to be doing what's called the Internet of Things World. So they're running a full conference in the Convention Centre in Dublin, and they asked us to take over the health stream part of that event. And we said we would under one condition, that we actually had that event free, that people could come to it from all over and actually just attend and find out all the different Internet of Things, Internet of Patients, startups that are actually in Ireland, and create awareness of these startups that are there as well. And then the second 2 days are the 22nd and the 23rd of November, and that's our innovation showcase, how this whole week actually originally began. And we're working again with Microsoft, Samsung and Trinity College as well. And it's going to be held in the Science Gallery in Dublin. And it's going to be a free event for anyone to attend, healthcare professionals, Joe Public. We're working really strongly to try and get schools to bring their kids with them to try and find out the different technologies that are happening in Ireland. We're going to show things like the art of the possible, what could actually happen if we were able to invest in eHealth, and also show some of the really good projects that are currently in Ireland that people just don't get to hear about. So we're really proud of this Innovation Showcase, and we can't wait for it to happen, and you are all invited to that as well. And on the last day, we have an event called HIMSS. HIMSS Executive Leadership Summit is happening on the 24th of November. And this event has actually never left London before, so it's the first time it's going to be in Dublin. And it's going to bring together global thinkers around health to Ireland to talk about the different things that are happening in their countries and their organisations and what they're doing to make a difference in eHealth. And a really brilliant part of this event is the last part of the event is going to be a workshop around the electronic health record personas that Richard was speaking about. So at the end of that event, we're actually going to come away with a persona for a healthcare IT manager that has been developed by all these great minds that have came to Ireland for this event. So we're really, really excited about that. So just to finish off, these are our details. Please get in contact. You can either email us or you can follow us on Twitter as well, and we'd love to get in contact with anyone that's interested in learning more. Thank you.
Thank you.